Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
This is Dr. Tom Roselle, live in studio. It's a beautiful day outside. It's a whole lot better than where I just came from. Never mind, 888-630-9625. That's 888-630-9625. Love to talk to you on any subjects that you have in mind. Perhaps you've tried, you've applied, you've done the same old, come up with the same old thing, something that doesn't work. Well, here's your opportunity to kind of put the fire out or looking around the corner with without drugs, without surgery. Wouldn't that be nice? As a matter of fact, I went to a conference this weekend. I was at the Florida Chiropractic Association meeting, convention. This is a huge thing. It was like in excess of 200 vendors there. There were probably 3,000 people, staff, doctors. And so when I attend these conferences, particularly when I don't have to present and teach, which I didn't this weekend, I get to be the observer. I get to listen. I get to talk to people. I get to network. And I came up with a whole lot of stuff. So what did I do? Like any good boy would do, right? When he has something that comes up on the biochemical end of the fence, you go to the experts. You call home and you say, Sue, listen, I need help. So you're coming in and we're going to talk. And she says, what are we going to talk about? I said, don't worry about it. Hi, Sue.
Good afternoon.
Yeah, it is good afternoon. See, you're not even in sync yet.
I'm not.
No, but we're as all of you know, Sue Roselle is the head of our nutrition department at the Roselle Center for Healing. And so when I want to talk about biochemical stuff and nutrition and so forth, I call the boss. And so we're going to talk about stuff. And she said, what are we going to talk about? I said, don't worry about it. I'll talk to you when we get in the air.
Plan ahead.
Plan ahead. And, but there were some really good people there. So there was a guy that Dr. Vasquez.
Oh, yes.
Yes. And I sat into his session a couple of times, and he was talking about functional inflammatory protocols. And the subtopic was common misdiagnosis in chronic inflammation and pain management, which was kind of a huge
That's
topic.
A huge topic.
Right. But what he got into talking about a lot of the things that we're constantly browbeating our patients about, the different side effects of drugs that they're on and why they don't work anyway, and how they end up causing all kinds of things, a plethora, Pandora's box of side symptoms that they suffer from, and deficiencies and so forth. And, when you look at, for example, we'll take something as broad-based as rheumatoid arthritis. And, here's what the deal is. Do you know that when you deal with a rheumatoid patient, the drugs that they given, their favorite is methotrexate, just dealing with the cost of the medication, we're talking $50,000 to $150,000 over a 2-year period.
I know.
And not only that, but what the actual odds are, and this is from board-certified rheumatologists, that provides about a 10% probability of sustained relief or improvement. 10% for $50,000 to $150,000. Yeah.
Uh-huh.
I sat there and I'm listening to this stuff, and, we've known this. And he said, Dr. Vasquez I love listening to him because he's a great guy. He's like a walking dictionary.
He is. And actually, he has a book out by that title, Functional Inflammation. There's a couple other words after it, but that Dr. Vasquez is the author of that, and he talks about all of this stuff.
He said, and I sat there and I said, sustained remission, because I mimicked what he was saying when I'm sitting there, because my mouth was, even though I know this stuff, it just kind of nice to hear somebody else that has the credentials. He's a chiropractor, he's an osteopath, and he's a medical physician as well. These guys like these alphabet soups next to their name. It's like, wow. But he said that, that it's in daily practice it's uncommon that they're only able to reach about 17 to 36% of rheumatoid patients and put them into some state of remission for only 6 months.
I know.
And then after that, they rebound like crazy.
That's right. And if they go off the medication early, they rebound. It's like steroidal medications. You get that rebound effect once you're no longer on them. Trouble with methotrexate is it also severely depletes folic acid and
B12.
Well, and B12 as well. But folate, they finally, the medical field has finally recognized that if they give the methotrexate, they have to give folic acid, because what was happening is they were ending up with people with elevated homocysteine, and we were having trouble with liver detoxification, and the potential for other cancers to develop were starting to mount. So all kinds of other issues were happening as a result of trying to get the 10-12% remission for rheumatoid arthritis. So at least now most physicians are recommending that patients take a folic acid supplement.
Oh, gee, big deal. Wow. Right. So, I mean, the class that I was taking, right, is called Prevention of Medical Errors. And I'm sitting there and I'm saying, I have to worry about medical errors. I'm doing nutrition, and these guys are giving drugs that have side effects called death.
That's right.
Cancer, degenerative disease, making things worse, rebound phenomena.
That's right.
Right. What was I doing in that class?
Well, I was reading about some stuff last night, and one of the things that hit me was an article that stated that this country, somewhere between 40 and 60% of the population is on one or more prescription medications, all of which have side effects, all of which create other problems that lead them to have to go on to other medications to keep the other problems down. And it's like a snowball going down a mountainside. And the amount of nutrients that are depleted because of the medication or depleted because of the way it has to be processed out of the body, and the side effects of the body being depleted of things that keep their blood pressures normal, keep their alkalinity normal, keep their liver functioning and detoxing the way it should be, keeping their brains working the way they should be. It's scary, and we're talking every age. We're talking children all the way to the people who are age old in nursing homes and everything in between.
Well, see, first of all, your information's inaccurate by a year.
Oh, okay.
It's now 2 medications per person.
2 medications. Yes. Well, that's to take care of the one medication that they started the year before.
That's right. So here's the deal. So you have somebody like you and me that we take no medications and haven't been on medications forever, right? Okay. So that means that everybody else out there is taking a hell of a lot more to make up for what we're not taking. And there's a lot of other people. That goes even to the place of, sugar. The average consumption of sugar per person in the United States is 170 pounds.
Yeah.
We don't do that.
Not including the artificial stuff.
Right. And we don't do that stuff.
No.
So who's eating our share?
Well, that's one of the things that I love about our patients, because they get it. They've discovered that, if they eat foods that the Creator intended for us to do, it makes the body work better. And if they do the lifestyle things like get enough sleep and they get some exercise and they try to reduce their stress load of it and start laughing once in a while, lo and behold, those medications are less necessary and not necessary at all.
Really?
And
I wouldn't have guessed that at all.
I know.
Yeah.
I have to laugh. I have women who have restored bone density or are improving their bone density without the use of the medications, and their doctor looks at the DEXA scans and say, well, yes, you are improving, but you can't accomplish the full amount unless you take this medication.
Yeah, take this drug for the rest of your life.
And I'm looking at these women, and they're just looking back at me with this sense of wonder in their eyes, like, what is it that I'm doing that they're not understanding?
My guest in studio, keeping me straight, I come back and I'm kind of brain dead, so I had to have somebody to talk to today. Sue Roselle, the head of the nutrition department at the Roselle Center for Healing. I'd like to remind you that the Roselle Center for Healing is celebrating Caring for Others' 15 years of commitment to public service. Caring for Others is a 501c3 foundation charity that gives health care to people who can't afford anything, that goes out and gives scholarship because they're going to alternative care schools, meaning chiropractic, acupuncture, nutrition, and so forth, and does public information programs. And in light of that, in support of them, the Roselle Center for Healing, our doctors have graciously offered to extend their time through September 21st for a consultation, not a full examination. You'd like to come in and just chit-chat with one of my docs to find out if natural health care can be a benefit to the problems that you're facing in your life. You can do that for a $49 donation to Caring for Others. Now, it's a consultation. It's not an examination, but we'll sit down with you and we'll do a case history, talk about what's going on with your situation, and find out whether or not you should take the next step. You should explore it further, and obviously it's up to you. You have absolutely no commitment to us. But what we're doing is for a $49 tax-exempt status donation to Caring for Others, all you got to do is pick up the phone, call our office at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to have a $49 consultation, a tax-deductible consultation. You get a receipt, not from us. You'll get it from Caring for Others that says, you can take it off your taxes, and you get to talk to one of my docs, and they set the time aside and so forth. If you'd like to do that, pick up the phone today and give us a call. More than happy to help you, and more importantly, that we're all together helping, caring for others, and those people who don't have the means to do anything, but also supporting young people who are going to integrative care schools and becoming doctors of chiropractic, doctors of nutrition, doctors of naturopathic medicine, doctors of acupuncture. So give us a call, 703-698-7117. Sue, one of the things that we talked about, or Dr. Vasquez talks about, this we'll talk about other people as well, and some other things I want to talk about as the show goes on, but the hypertension and diabetic medication, and the ACE inhibitors, the PRLs, the ARBs, and the sartans, and so forth, and huge side effects, and what happens, with different calcium levels and vitamin D levels and B12 and so forth. They're atrocious. Plus the fact they don't work; they kill people.
Well. That's true. And if you read the inserts that come with the prescriptions, the number one problem with them is fatigue. But across the board, all of those medicines you just mentioned, they deplete magnesium, among other things. Magnesium is necessary for more than 300 different functions in the body. Anywhere from neurotransmitters, your happy juices in your brain, your ability to produce melatonin so you sleep well, your body's ability to keep your bones healthy, the regulation of your blood pressure by relaxing the artery muscles themselves, allowing the heart to pump better because calcium and magnesium work in tandem for that heart to work properly, keeping you from having leg cramps, foot cramps, works with liver detoxification. All of these things involve the use of magnesium, and that is only one of the nutrients that go out in every one of those medications, every one of them.
The interesting thing is that you get a diabetic and you put them on metformin, which is the favorite out there today, right? Mm-hmm. And so they're what the doctors like to say, well, you're non-insulin dependent diabetic, which means that we're not going to inject you today. We're just going to give you this pill to help stabilize it. Mm-hmm. Well, the problem with this pill is the thing that it blocks. It actually blocks B12 absorption in the body, and it causes all kinds of other things. It causes coenzyme Q10 to become ineffective, and the number one problem with diabetics as things begin to move forward. Now, there's many problems, but the one that initially shows up first is what they call diabetic peripheral neuropathy. Uh-huh. And that diabetic peripheral neuropathy is about the inability to absorb vitamin B12. Mm-hmm. And they don't supplement it, and they need to supplement it at very high levels. And it's not just, B12 is cyanocobalamin. So just don't go out there and run to the store and get the cheap B12. There's because that's not going to work. There's one type that works. And by the way, Dr. Vasquez agrees with me that using hydroxycobalamin is the most important because it acts as a detoxifying scavenger. Mm-hmm. But that's just a side effect for you and me. So, okay, I said it.
And if you want to take
so you can't yell at me on the radio.
I'm not.
Okay, thanks.
You take it one step further. They also deplete B6 and folic acid. And the second most prevalent problem with diabetes is the loss of vision. Diabetic retinopathy.
You know, we got to take a break.
I know.
So don't go away.
Okay.
Be right back. This is Dr. Tom Roselle.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio. It's beautiful outside, and get out and enjoy the day. Meanwhile, before you do that, though, you got to pay attention to the rest of the program. 888-630-9625. That's how you find us here. And how you find me or any of my staff after the program is you can do it a couple different ways, but the fastest way is by email. Go to our website. Go to rosellecare.com. That's rosellecare.com, and send us a note, and I promise you we'll respond very quickly. I like to answer as many of them as I possibly can by myself. If you have a note for Sue, you can do it that way. If you have a note for any of the doctors, you can do it that way as well. rosellecare.com. Or call us here at 888-630-9625. I told Sue at the break that we were going to play a game, but she said we weren't going to do it. It was called Stump Sue. And those of you, you call in and ask a question and see who can stump her. And if you do get her stumped, then there's going to be a special gift. I'll think about it as the program goes on. Maybe we'll do that.
Thanks.
Yeah, well, it's a nice day outside. I got to keep it interesting. We're talking about different inflammatory pathways and the side effects of different medications, side effects that you, unfortunately, sustain because your doctor told you to take these drugs for the rest of your life, and they're huge. We talked a little bit about metformin, and we get into just the hypertension medications. So they're called, the ACE inhibitors and the ARBs and so forth, the sartans, and they're crazy because they're the most commonly prescribed type of diuretic, and they do one thing: they increase blood calcium, and as well as getting rid of potassium. So you got calcium going up, you got potassium going down,
zinc going down,
and you got zinc going down, and you have a huge decrease in vitamin D3. Vitamin D3 goes out the door. Mm-hmm. And so all these people that are out there, and they get on these medications, their hearts start flipping around, which, oh, by the way, that's a side effect. And, as you said earlier, the number one depletion in so many of these medications is magnesium. And that's the number one mineral that most people are highly, highly depleted from. 80 to 85%
of us don't have enough.
It's like ridiculous.
Yeah.
I mean,
but yet it's so essential for every health issue we have.
Yeah, it makes your heart work, makes your nerves work, makes your hormones work, makes your adrenal system, go on and so forth.
Happy juice in your brain.
That's right. Serotonin,
Lots of
dopamine.
people want to have happy juices in their brain.
Well, that starts with the gut.
Yeah.
That's the other piece, because 80% of your neurochemistry is intestinal tract induced.
But if you don't have enough magnesium, you're not making it there either.
No, it doesn't happen. And most people's intestinal tracts are all screwed up, not only because of the medications that they're taking, but also because of their inadequate diet plans.
Yeah. That's part of the problem with the magnesium. It's in lots of our foods, and it's in any food that has calcium, but it's only a fraction of the amount of calcium. And that's real food. That's not packaged things with labels, things that come out of the fast food places, the plastic foods, and the neurotransmitter poisons like MSG and NutraSweet and all that kind of stuff. Those also add into the depletion. So you've got people on prescription meds, you've got people on over-the-counter meds, which also take out a lot of nutrients. And then they're eating plastic food, and it's no wonder people are sick. It's no wonder people don't feel well. And they try, their best. They go to the gym, and they're working out, and they say, I've got to go to the gym 5 days a week, or my weight will just get out of control. Well, that's true to some extent, but let's take a look at the foundation. If you don't have the right fuel, the motors aren't going to run very well.
Yeah, then you burn the car out.
That's right.
You deplete it. You destroy it.
That's right. And unfortunately, we think about over-the-counter stuff as innocuous, but it's not. You take Tylenol every time you get an ache and a pain. You go to the gym 5 days a week, you're on Advil the rest of the week trying to get over the pain that you created in the gym. Well, the Advil is adding to the ultimate pain, not to mention destruction of your digestive tract, so you can't get the nutrients in the first place.
There's an interesting medication. This time of the year and in the springtime, many of our patients are being put on a drug called spirulactone, and to try to decrease the inflammatory reactions, that are due to allergy responses and breathing patterns and so forth. And there's an interesting side effect that goes along with that drug. It's potassium sparing. And so it's driving the potassium levels high. And then subsequently all the side effects, because on blood work, if you get a potassium level that's above 6, what happens is called an emergency situation. And you end up with cardiac problems and shutdown of other nervous system essentials and so forth. We're going to get into that and much, much more in the second half of the program. We're going to talk a little bit about the different types of drugs that you're on, and what happens nutritionally and why they're so bad for you. Love to have your phone calls and questions on any subject, no matter what it is. Give us a call here at 888-630-9625. That's 888-630-9625. See, this is what happens. I come back from a program and I'm on fire. And just think about my patients tomorrow. They're going to have to deal with all this.
They're going to have to deal with you.
We'll be right back. Don't go away. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We're kind of doing a potpourri of kind of a spin-off of my travels the last 3-4 days down in Florida. Yeah, I actually went to school. They make me do that too. So, Sue, it's unfair.
Why?
Because, I only get a few credits for the hours that I teach all year long. And they still make me go to class.
Yeah, because you know what you're teaching. You got to learn new stuff.
Oh, is that the point?
Yeah, that's why.
Okay. Yeah, just you're no better than them. I thought it was just because they want me to pay the tuition going down there or something. 888-630-9625. Yeah. Okay. So we're talking about drug-depleted nutritional deficiencies, and we're talking about why these things don't work. But before we get into that, I also want to remind our callers that the Roselle Center for Healing is supporting Caring for Others, an amazing charity, a 501c3. They've been at this game for 15 years. What do? They have 3 primary pillars. The first one is to provide health care for people who have nothing, people who are indigent, people who are on the street. Second is scholarship for kids that are going to integrative care schools, acupuncture, chiropractic, naturopathic colleges, nutritional schools, and so forth. And the third is public information, public service. If you'd like to help us support them, our doctors are extending their time through the September 21st, and what they're doing is they're setting up consultation times. And what they're doing is that we're not going to do a full exam, but we're going to consult with you and to see whether or not alternative care, natural therapeutics are right for your specific condition. So you don't have to commit to anything and come in. But what we're asking you to do is donate $49 to Caring for Others. It's a 501c3 foundation. Caring for Others will give you a receipt. You get to deduct it from your taxes, and you get to find out if there's anything that can be done without drugs, without surgery. And I would encourage you to take advantage of this. Call our office at 703-698-7117, 703-698-7117. You have to complete the consultation by September the 21st. So pick up the phone. Don't wait. That's not that long. We're already into the fall season now. Sue, let's talk a little bit more about these silly depletions. We talked about methotrexate. We're talking about some of the hypertension medications, some of the problems with diabetes and so forth. Go ahead. You had a comment.
We were talking about the effects of the diuretics and some of the problems that they cause. Well, one of the things that concerns me whenever people have to take these kinds of medicines and they're not following up with proper nutrient support, and I'm talking not just what they can get from good food, but also some nutrients of good quality, they deplete the B vitamins, particularly B1, which is essential for good heart function and good heart valve function, as well as B6. And that combination of depletion can also play a role in raising homocysteine, which is a factor in increased risk for heart disease and plaquing and hypertension. So we're trying to work with one problem, but yet we're still doing things that can contribute to the continuation of that problem, which is the high blood pressure in the first place.
Well, you're dealing with these different types of myriads of problems, and you start throwing medications at them. And, we've talked about forever that you listen to radio, you listen to television, and they put these ads on that are structured by the pharmaceutical associations, right? And, they tell you what it's going to do and why you should have it. Then at the bottom of it, they give you the side effects, and including death in some situations, increased risk of. But the marketing is done so powerfully and so beautifully. You feel guilty, seriously guilty,
when you're not taking
if you're not taking it. It's like, really?
Yeah.
Let's go to the phones. Tom, how can I help you?
Hi, how are you doing?
Doing well. What's on your mind? You have a son with esophagitis.
Right, and he's been diagnosed with the esophagitis, and the doctor recommended that after testing that he's given budesonide with 10 packets of Splenda to create a slurry.
Oh, my God. You got to be kidding me.
To create a what?
No, I'm not.
To create what?
Sort of a slurry to coat his the tract so he can eat the foods that he once was allergic to.
How old is this child?
He's 5.
You go find yourself another doctor who knows what the heck they're talking about, because what they just did is set up a scenario for your son to have throat cancer. If you take a look at the side effects of Splenda and all the ramifications down the point, they're going to kill this child. Long term, it's devastating. There's so much more that can be done. Let me ask you some questions. When your son diagnosed with esophagitis, why was he diagnosed? What were the symptom process? What happened?
Well, at first he could not. He was allergic to certain foods, such as soybean, soy protein, wheat, and dairy.
Tom, excuse me. Let me interrupt just for a second.
Sure.
Did they call it eosinophilia esophagitis?
I believe so.
Okay. It's an over-the-top allergic reaction to all kinds. Eosinophilia is a white blood cell reaction to all kinds of allergic responses, and it has to do with the intestinal tract and the adrenal system. A couple of years ago, I did a program for MTV and their True Life presentation. There was a young girl that came to my office, and I took the risk to treating her, and she went into allergic reaction so severely that she would have seizure activities and anaphylaxis and so forth. And she was being compared to a young guy who was being treated medically out of Houston, Texas. And this young boy was a teenager in high school, and he had the diagnosis of eosinophilia esophagitis. Subsequently, as you can imagine from that program, we've treated a ton of people with that type of condition. And what I'm saying to you, you find the why behind this. These conditions are highly reversible, but not with the type of garbage that they're doing with your son and putting him basically on PABM and not allowing him to eat anything.
Are they wanting him to go ahead and eat the foods that he was allergic to?
At first, we put him on a restricted diet. So when he had pasta, it would be rice pasta. He would have lamb. He could have carrots and broccoli. But the things that he was allergic to, he couldn't have. So the budesonide mixed with the 10 packets of Splenda would allow him to consume the foods that he was allergic to.
Okay, here that tends to continue. Allowing him to have the foods he's allergic to, first of all, breaks down his digestive tract and its ability to break things down and absorb them properly, and it sets him up for a chronic irritable bowel, if not inflammatory bowel problem.
Right, because his stomach cramps from time to time.
I'm sure it does, and it's his body saying he doesn't tolerate those foods. So the first thing is you pull him off the foods he's allergic to. There are so many other foods out there he can have. Gluten, it covers all the bases. If it's only wheat and dairy and soy are fairly easily avoided once you understand where they come from, where they're located, and what kinds of foods they're in. Substitute so many other things for those foods that he can't have. That just takes the irritation out, so you're not scratching the scab off every day.
Yeah, the problem is there's low weight gain. I'm a thin person to begin with, and so when he was younger, well, he's still young, but he's not gaining the amount of weight that he should gain, although he's functioning.
Well, I'm sure he's not.
He is not going to gain weight if his gut doesn't absorb, and if you put things in that his body does not want, his gut stops absorbing, and that means all nutrients are not going to get in. You can beef up his calorie intake by using smoothies that use different types of protein besides soy and dairy. There's a number of them out there. Rice is usually the purest one. There's also some protein powders made out of vegan, like seeds and things like that. You can make super smoothies for him that are like milkshakes to give him extra calories. You can give him the protein foods he can have. Fish and poultry usually are the easiest.
Tom, and there's an easy way of finding that out. The normal testing that allopathic medicine does, which is skin testing, sometimes they'll do some other forms, but it's the most common, it's the most least expensive. That's why they do that. Has a 40% inaccuracy rate relative to it's pinpointing what he has a sensitivity to. There's a whole lot more that can be done. And through neuromuscle function testing, which we do in our specialty, you can not only find them, but you can desensitize them, and then by supporting the intestinal tract, actually getting it to heal and closing up, visualize the gut as a fibrous, not a fibrous, but a meshwork, very much like a colander. So you have these small little holes in it. And the more irritation goes into the gut, the more inflammation, which is consistent with an inflammatory reaction, the bigger these holes become. And the less able the body is to break down all of the stuff that goes into it. So he absorbs this stuff, becomes more reactive, and ends up with, stomach pain and neurological symptoms. They can be just anxiety and dizziness and kind of a spaced out, depressed type of thing. Can be diagnosed as ADD with that. The list for Splenda is huge just with that, notwithstanding the other problems that are there. But this stuff can be reversed.
That's right. And
do you have a number? I would love to have him see you.
Tom, you can call us at 703-698-7117. What I'd like you to do, if you make that call, is I'd like you to talk to our patient advocate. Her name is Dareth, and she will handle that very effectively because it's a very special case. But if you do that, you can go to our website at rosellecare.com so you can learn more about us. But this is something that can be done and can be done effectively. If you like to talk to me back and forth, get a hold of me on the website, send notes. I'll do that as well. But, Tom, we'll do everything we can to help you.
Thank you. So 703-698-7117. Great. Thank you so much.
You're welcome.
And our number here is 888-630-9625. If I sounded a little excited, I was.
I know.
I mean, it breaks.
A child.
Oh my God, it breaks my heart, particularly with what you know that this young boy is going to go through.
That's right. And where he's going to go from here.
And where he's going to go from here.
Yeah.
The potential side effects are absolutely devastating, particularly when you're Splenda. Oh, look it up. Just go on the web, say side effects of Splenda, and you're gonna see a list of all kinds of stuff. And then if you cross-reference it, it's like, oh my God! And they have the audacity, the inability to look at a child and say, do I want to destroy this young person? Isn't there another way?
Well, see, what you eat doesn't make a difference.
Oh, no. No. What you put in your body,
only the medicines make a difference.
Yeah.
Not the food.
Yeah.
We didn't get here on this earth.
This is a family show. You don't want to get me started, Sue.
We had to go 50,000 years to come up with a way to make our food better for us. I know.
Yeah. There's not too often that I'm left speechless. Because if we were in the office right now and we were sitting there with our docs, there would be other conversations that would be had, and unfortunately the FCC would not permit the vocabulary that would run from my mouth at this point.
No, but there are unfortunately so many misunderstandings of how our bodies work and what can be done to alter that misfunctioning of the body. I don't like to call it a disease necessarily. And we don't have to get in the way of the body. We need to get out of the way of the body. Give it what it needs, give it the fuel it needs, and let the body do its thing. It's got it genetically programmed to be alive and functioning to 120 years.
You get a child, going back to this kid, right? I can't get him off my brain now. You get this child, you've done nothing more than get him off of every carb, every processed food that you can possibly get them off of. You increase everything that's going to potentiate the capacity of mitochondria in the body so it actually will work, so it actually signals the way it is. Heal the intestinal lining, increase digestive function, fix the neurology, and this kid's got a new life.
Yeah.
But God forbid they think about that. I mean, it's all compartmentalized. He's got a disease called this, and eosinophilia esophagitis, and that's how they're going to fix it. And God help us all.
I know.
It's awful. We're coming up to a break. I need the break. Don't go away. We'll be right back after these messages.
Sit down.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. You're listening to Dr. Tom Roselle live. This is Dr. Tom Roselle. We've been in studio. It's a beautiful day outside, and you always can reach us here at 12 noon. Always live programs. Rarely do we ever have a canned show for you because we want to keep you up to date and informed on the most intimate pieces of information on holistic and integrative healthcare. If you'd like to find out more about what we do, or you'd like to find out about anything, any question that you have, you can get a hold of us at rosellecare.com. That's ROSELLECARE.com. Write me a note. We'll get back to you. Write Sue a note. She'll get back to you. And if you'd like to talk to us before you send a note or come in or anything else, you can always do that by 703-698-7117. And by the way, that's how you take advantage of our support for Caring for Others. And we're doing this through the 21st of September. Caring for Others is celebrating 15 years service to the Washington metropolitan community. They're a 501c3 foundation, and we'd like to help them, and we'd like you to help us help them. If you'd like consultation with one of our docs, totally tax deductible, receipt from Caring for Others. It goes to them, not us. We're donating our time. All you need to do is call us, say, hey, listen, and you come in, you're ready to check for $49 to Caring for Others. Our docs will sit and do a consultation with you, and then it's up to you if you'd like to proceed, beyond that point. Sue.
Yes.
Let's wrap this up a little bit. I know you're biting with bated breath.
I've got a couple of points that I wanted people to hear. All right. If you're interested in following up on how we're being duped into having to use medications for even mild things. I mean, they actually have one for shyness, believe it or not. It's called social phobia.
Yeah.
For real.
It's like ADD. It doesn't have a physical diagnosis.
Well, anyway, there is one super guy. His name is Dr. John Abramson. He's a medical doctor, and he's a lecturer in the healthcare policy at Harvard Medical School. Okay, this is not some fly-by-night guy who's out there, sitting in the trees. He has written a book called Overdosed America, The Broken Promise of American Medicine, and he has a website, www.overdosedamerica.com. There's also another website called www.pharmedout.org, and that's from the Georgetown University Medical Center. Okay, these are two websites from highly respected organizations. And
there's some people out there really good.
They are out there. These are the good guys. These are the guys that want you to understand how the drug companies don't want to kill you, but they don't want you well. And they are trying to dupe you with all of this new popular advertising and everything that they've got out there. Next time you see a drug ad, close your eyes as you listen so you don't get duped by the happy family and the dog chasing the ball and the lady swimming in the ocean and all that.
Yeah, and all the pretty people.
Yeah, listen to what they're saying.
Yeah, just really, so get away or turn around, don't watch the tube, and just listen to the words, because you're going to sit there and you're going to get as angry as I am.
But listen fast, because they talk fast.
Yeah, they do. It's diadochokinetic compression. I almost couldn't say that word.
I know.
We're coming up to the end of the program, and as always, way too short. We'd love to do this longer for you, but you got to talk to the radio station to get that to happen. We'll see you next week, same time, same old place. This is Dr. Tom Roselle.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.